Sarah Middleton, and today I'll be assessing the elbow joint. As you can see, my patient is in a supine position with a towel roll under her distal humerus. The first thing I'm going to assess is elbow flexion and extension. To do this, I'm going to line the axis of my goniometer up with her lateral epicondyle. My stationary arm will be up the midshaft of the humerus towards the acromion. My movement arm will be down the shaft of the radius pointing towards the radial styloid process. I'm going to stabilize her humerus and have her actively flex her elbow up as far as she can go. Okay, and I'm reading a value of 145, which is just about normal, close to the normal value of 150. Now I'm going to be assessing her elbow extension. So I'm going to have the same landmarks for my goniometer. This time, I'm going to allow her elbow to relax on the towel roll and see if she obtains any hyperextension. And right now, I'm reading a value of about 8 degrees hyperextension, which a value of up to 15 can be considered normal. I'm going to be performing a manual muscle test on her biceps brachii and her triceps brachii. As you can see, my patient is in a supine position. I'm going to have, first I'm doing the biceps brachii. I'm going to have her flex her arm into near end range. I'm going to stabilize the humerus and apply my line of force on her distal forearm. Can I have you hold this position for me? Okay, and I'm applying resistance for 5 seconds. And I'm unable to break the test position for 5 seconds under maximal resistance, so I'm going to grade her at a 5 out of 5. Now I'm going to be assessing the triceps. I'm going to bring her shoulder into some slight flexion, her elbow into near end range extension. I'm going to stabilize the humerus and apply force to the distal forearm in order to try to bring her into elbow flexion. So if you would please hold this position. I'm going to apply resistance for about 5 seconds. And again, I'm unable to break the test position under maximal resistance, so I'm going to grade her at a 5 out of 5. I'll be assessing the muscle length of the triceps brachii muscle. As you can see, I have my patient in a supine position, laying towards the edge of the bed with the pillow out of her way so that we're not limiting her range of motion in any way. So the first thing that I'm going to do is I'm going to lengthen the triceps brachii over the 2 joints that it crosses. So I'm going to flex the elbow and flex the shoulder to its end range. Then I'm going to measure this angle using the same landmarks that I used earlier. And I'm reading a value of 140. Previously, when I measured her elbow flexion, I got a value of 145. So with a difference of only 5 degrees, I'm going to say that her triceps muscle length is within normal limits and unimpaired.